overcompensating a little bit for right side. Okay. So the next thing, what is the next thing on the list? Lateral pole. Lateral pole. Am I missing anything? Posterior compartment and lateral pole is where I'm going now in my clinical mind. Am I missing anything? Okay. All right. So now I'm just going to palpate. I just want to feel the outside. Is that tender?
Not so much.
Okay. And then I'm going to go posterior. Okay, just in front of that, the ear, the posterior aspect. And my guess is
A little bit, yeah. A little bit more than a little bit.
my guess is probably this posterior compartment is a little bit more tender even than the lateral side. So he's got a little bit more tenderness to palpation of the lateral pole and the posterior compartment. If I had to guess in terms of the swelling, I would say the posterior compartment's a little more tender. Is that correct? I didn't pay him to say that. So, even though I did bring him in. The tenderness is just something, so I'm pretty convinced this is probably he's had the history of trauma, and this would be a temporal mandibular problem. And the motion. So, the next thing that I will palpate is the lateral pterygoid. I'm going to get a new pair of gloves. So with this, you're going to take the tip of your 5th digit, bring it up to the upper corner. I want you to do this on yourself first. The upper lateral corner of the mouth between the teeth, okay, and the cheek, okay. So that, and when we say teeth, in between the mandibular and maxillary teeth. Okay. I'm going to come on the other side. I put the gloves on in front of the patient so he knows I didn't wipe my nose on the way over here or anything weird. Okay. I'll never forget I had a dentist do that. I'm like, oh.
I would have said something.
Which is unusual. I just think he was busy talking. Forgot. Of course, me being a quiet, shy person, I said nothing, right? Wrong. You're not putting that glove in your mouth, are you? In my mouth, are you? It's like, oh no, I'm sorry. I'm like, yeah, after you wipe your nose. So anyway. So what I'm going to do is first I'm going to palpate the outside, and I tell the patient why I'm going in the mouth. Okay, so there's some muscles that are important. You know, these were tender on the other side, and I'm checking this side so you can. Should I do it on the other side? No, I'm going to have to do it on this side. And I'll show you the angle on both sides. The,
Can you zoom in a bit?
can you zoom in a little bit? Don't get me in trouble. So, 5th digit, and I'm going to come in, and I'm going to feel the muscles at the very back. So I've got to find the back of the teeth, all right? And I usually tell the patient to swallow. And you may be able to feel the lateral pterygoid at the very back upper part of that. I have to go all the way up. Okay, and I'm coming in at the jaw. So there's the masseter, and it would be right in there. Okay, it's pretty high. So I'm basically going all the way into the upper corner. So yeah, lighting's not helping. Did you guys have an idea? So I'm going to come over on this side. Bad position, but I don't want you guys to really know. I'm going to come in at something here, all the way to that upper angle. Okay. And it would be in front of the masseter. So you try it on yourself. Yes.
So he was kind of opening his mouth in the picture. She's just kind of relaxed. Do you do it in both positions, or do you want them to actively be opening?
You want them to relax at some point. I'm trying to get to that. You want them to close their mouth and relax. So I have them opening it and I can feel it, and I'm just palpating for tenderness. So relax for me. And you'll probably get a better feel in terms of able to get up a little bit further with them closed. One of the things that I like to do is with the mouth all the way open is I feel like I can get an idea in terms of how hyperactive the muscles within the pterygoid, the medial and lateral are, and relax down for me, and then see if there's continued all the way. you're not gonna bite.
Okay, I was worried.
I'm on the outside. So, and the patients are a little bit worried, and I'm at a weird angle, so I bet you guys can see me. But coming all the way at the end, and you guys can feel it a little bit better on yourself, okay? Is that tender?
A little bit, yeah. A little bit more than the last one.
Okay, I'm gonna come here again. So now I'm gonna compare left to right. So that's what I do in terms of palpation for the structures. I also oftentimes will look at the anterior cervical, the anterior, the deep cervical musculature as well, hyoid, omohyoid, and those structures. But for the most part, these are the main ones I want you to palpate for tenderness. Okay? Questions? Yes.
Did you do the superhyoid? Did you say?
No, I did not. And usually the temporalis, the masseter, do you do suprahyoid at all? Palpate? No. I mean, yeah.
I just asked because it
Because
was
it's listed on there. It's listed in terms of the sensitivity and specificity.
Okay.
Yeah, but, so you could. I don't, but do you? Okay. All right. Any questions on that? So what I want you to do now, I'm going to give you these little break time.